Hello friends, let us discuss the antihypertensive class of a drug, calcium channel blockers or CCBs. Medicines like amlodipine, cinnabar, diltiazem comes under this class. Let us see how calcium channel blockers help in reducing the blood pressure. Friends, you are aware when a blood is passing through the blood vessels, particularly the arteries, it creates a pressure on the walls which is known as a blood pressure. Normal blood pressure is 120 by 80 mmHg, where the 120 is systolic, 80 is diastolic. Now, this vascular blood vessels, on the cells of the vascular blood vessels, a specific channels are present. These channels are named calcium channels. Within a blood, a calcium is available. This calcium, with the help of a calcium channel, enters into the vascular cell. The moment it enters into the cell of a blood vessel, it creates a contraction known as vasoconstriction. Because of a vasoconstriction, the pressure, the blood pressure increases. So, when a calcium enters through the calcium channel into the vascular cell, it produces a vasoconstriction and increase in the blood pressure. In hypertensive patient, calcium level generally been found elevated, so more calcium is available into the blood. Since more calcium is available into blood, more calcium goes and bind with the calcium channels. Since more calcium enters into the vascular cells, there is a strong vasoconstriction produces. Since the vasoconstriction is higher, the blood pressure increase is also on a higher side. Thus, in a hypertensive patient, additional calcium produces more activation of a calcium channels results in strong vasoconstriction and more increase in a blood pressure. Similarly, the calcium channels are also present on the cardiac muscles. Calcium, which is present within the blood, also goes and enter through the calcium channels into the cardiac muscles. Once it enters into the cardiac muscles, it produces the contraction of the heart. That means the force of contraction increases. With increase in a force of contraction of the heart sends the blood with a more force. That means the blood pressure also increases. As I said, in hypertensive patient, the more calcium is present within the blood vessels or within a blood. Since the more calcium is present, more calcium goes and enter through the calcium channel into the cardiac muscles. Means the force of contraction is even higher. So the heart is sending the blood with higher force, results in increase in a blood pressure. More increase in a blood pressure, that results in hypertension. So to control this hypertension, we provide a drug, calcium channel blocker, amlodipine. What amlodipine does, amlodipine goes and block the calcium channels. Once amlodipine blocks the calcium channel, calcium from the blood not able to enter through the calcium channel into the cell results in reducing the force of contraction as well as reducing the vasoconstriction and results in control of the blood pressure. Thus, amlodipine blocks the calcium channel and reduces the blood pressure by reducing force of contraction and vasoconstriction. Thanks for watching. If you like it, please subscribe and share.